President.
Senator from Illinois.
Madam President, I thank my colleague from Oklahoma, and I couldn't say it any better or more effectively than he just did. Like Oklahoma, downstate Illinois is an area of smaller cities, rural towns, and small town communities, and many of them are lucky enough to have a great hospital, and they love their hospitals. They're not only important sources of medical care, they're a major part of the local economy, and they really are a rallying point for communities. The auxiliaries and volunteers and so many people make these hospitals just the focal point when you visit these communities. They're so proud of them. And of course, we're worried about what this current pandemic is going to do. I've had conference calls with leaders from more than 120 hospitals across Illinois. I invite the members of Congress in so we have bipartisan exchanges about the state of affairs. One hospital CEO from Crawford County, downstate along the Indiana border, told me he used to pay 22 cents for a surgical gown, and he now pays $11 to $20 for each one. Hospitals are facing limited access to reagents, swabs, and supplies that they need. The HEROES Act would direct the administration to utilize the Defense Production Act to help solve that problem, and I commend Senators Murphy and Baldwin for their legislation, which I'm joining to do the same. But one of the most profound consequences from the pandemic is the impact on the solvency of these hospitals. Across Illinois, rural hospitals are the heart and soul of the community. Otherwise, people drive literally for hours to get medical care, and sometimes in emergency situations. And they're important parts of the local economy. We think downstate hospitals generate $5 billion into our state economy each year, and I don't doubt that. This pandemic has pushed them to the brink. Even prior to this Congress, they were facing financial uncertainty. Part of this crisis, they were facing financial uncertainty. Half of rural hospitals were operating in the red. 1 in 4 were at risk of closure. And as the Senator from Oklahoma mentioned, 120 have closed across the nation in the past decade. We've done and fared a little better in Illinois, but we're worried about the future. When a rural hospital closes, not only doctors disappear, but jobs disappear, and businesses struggle to stay. The coronavirus pandemic has accelerated and compounded the strains we face. We believe our Illinois hospitals are losing $1.4 billion each month. Many, like those near nursing homes or meat processing plants, have had to expand surge staffing to deal with COVID patients. All have been forced to cancel outpatient and elective services. In Illinois, 70% of rural hospital revenue is from outpatient services. The same is true in neighboring states like Kentucky. Nationwide, rural hospitals have an average of only 33 days cash on hand. There's an immediate need to stabilize, and that's why we've come up with this bipartisan plan. Senator James Lankford and myself have introduced a bill called the Rural Hospital Closure Relief Act. It's supported by the American Hospital Association and the National Rural Health Association. It would update Medicare's critical access hospital designation to provide flexibility around the 35-mile distance requirement, so more rural hospitals would qualify for additional payments from the federal government. We project 6 hospitals in Iowa, scores more in Illinois, New York, and Kentucky would qualify for this financial lifeline, securing their stability. And we do it in a restrained, cost-effective manner by focusing on the hospitals that have faced financial losses and located in areas with shortage of health providers. It's common sense. This bipartisan bill is a priority for us. We want to make it a priority for the Senate, and we hope to do so. We know that we come to this discussion with a good, encouraging conversation with Senator Grassley today and the support of the Iowa Rural Health Association. The CEO and leader of the Kentucky Rural Health Association projects that more than 18 rural hospitals in that state are at high risk of closure, and we hope to make that point very clear to the majority leader. Several of them will be helped by our legislation. With a spike in COVID cases across rural America, we've seen hospitals reaching capacity, and we need to make sure that our hospitals, the ones that we're talking about in rural areas, survive. The health and economic toll of these crises demands, I hope, that the Democrats and Republicans in the Senate include this in any bipartisan package. The cost of inaction is disastrous. Senator Lankford and I are prepared to seek passage of this bill by unanimous consent today, but we've been encouraged to continue negotiating with our colleagues to see if we can make it part of a package, a timely part of a package in the near future. I hope that's the case, and we will hold off any unanimous consent request because of that hope.